This episode is brought to you by On Your Mark, a college success program for neurodivergent students at Marquette University. Call 414-288-0203.
Pretending to be someone they aren't or someone who they think will be accepted because they have to live in this environment and they feel like there's not another choice in order to get through the day or get through the moment.
Does autism look different in girls compared to boys? What might some of those differences look like? And what factors might influence those unique manifestations? Today, we're talking to Holly Blanc Moses, a licensed clinical mental health therapist and host of the Autism ADHD Podcast. We're talking about everything related to autism in girls. That's straight ahead on episode 159. I'm Emily Kircher-Morris, and this is the Neurodiversity Podcast.
What is neurodiversity?
You see the world differently.
Autism spectrum.
Gifted.
Complexities that are inherently inside.
ADHD.
Dysgraphia.
Tourette's.
All brains are different.
You are exactly what this world needs.
This is
The Neurodiversity
Podcast.
I'm really excited to make this official announcement. Many of you might be familiar with the seminal book, A Parent's Guide to Gifted Children, which was originally published in 2007. Dr. Jim Webb was the lead author on this book, and it greatly influenced the understanding of the needs of gifted children and how parents can support them. Jim passed away a few years ago, but his legacy lives on. A couple of years ago, one of the co-authors, Dr. Ed Amend, reached out to me and asked if I would be willing to be a co-author on a second edition of the book. We've been plugging away on revising information about twice exceptionality and adding important segments about all of the things that have changed in our world since the first edition came out. The second edition of A Parent's Guide to Gifted Children, a resource for caregivers and advocates, will be available on April 11th. It's available for pre-order now on Amazon, and I hope you'll take the time to check it out. Look for a link in the show notes. Okay, my conversation with Holly Blanc Moses is up next.
Previously on the Neurodiversity Podcast.
Change is a brave act. People become remarkably comfortable in their level of discomfort if they just sit in it long enough. I think there's definitely a coping aspect to that comes into play, and we have to say, okay, if we're helping someone cope with something in the process of change or in the process of just experiencing their world, that has value.
Yeah.
And I think more often than not, rather than solving your problem, is learning how to be aware and learning how to be able to tolerate frustration as part of the human experience. And I think that's something that we actually do very little of culturally these days, less so than maybe was present when I was a kid, for sure.
That's episode 154. Find it wherever you get your podcasts.
Today, I'm welcoming Holly Blanc Moses to the podcast. Holly is a licensed clinical mental health counselor and host of the Autism ADHD Podcast. Holly, thanks so much for joining us.
Thanks for having me today.
So we want to take a deep dive today in understanding autism in girls, everything from diagnostic procedures and how it looks different to what type of supports they need. And I know that there's been so much that's just really changed in how we understand autism generally in the last decade or two. I think a big area that awareness has grown has specifically been in what autism looks like in girls and women. And so, starting out this conversation, I think it's important to recognize that it's always hard to have these conversations without offering a lot of caveats, but we're making generalizations. And so we're going to keep those things in mind as we talk, but it can still help us to understand things with some broad strokes. So just to start us off, can you share a little bit about the differences that we frequently see in autistic girls compared to the stereotype of an autistic boy?
And I'm glad that you said stereotype, because that's exactly what it is. We have this idea in our head about what an autistic person looks like. It's usually a young boy and he likes trains and all these things that, the lay person might automatically think. And for a long time, we learned, and even us clinicians, it's autism is most likely to occur in a boy. Well, I don't think so. I don't think that's true. I think we are missing girls, and we have missed girls who are now women for so long, and they haven't gotten what they needed because we didn't know what to do. We didn't know how to support them, how to identify them. So that's wonderful that we're having this conversation today.
Having had all of that awareness there, what are some of those differences that we might see?
What I typically notice is the interests may look kind of stereotypical girl, and it's common, but it is presented in a different way where it might be more intense, or it might be focused on one or two different interests, whereas maybe girls that are neurotypical have more varied interests. So for instance, maybe an autistic girl likes horses, like a neurotypical girl might like horses, but their like and their interest is very passionate. And it may be something that they talk about frequently. It might be something that they want to spend all of their time doing or talking about. So even though these interests may be similar, the presentation of those interests are different.
One of the things that I notice with my autistic clients in general is that it's very difficult to tease out what is an interest that goes beyond that intensity when it's something that's kind of relevant in pop culture. So like Pokemon, Minecraft, like just different video games. Like, is that what you would expect for somebody of this age? Is that developmental, that they're just really into it? Or is it something that is to the exclusion of other areas? And so when you talk to that child about that particular interest, their communication might seem very appropriate. But if you try to go off of that, it's a little bit harder for them.
That's definitely the case. And what's exciting about those interests is for that little girl, they can feel excited about it. They know a lot about it. And there's something really beautiful about sharing information that you're passionate about. But like you said, if you were to talk about their passion, you would have probably a back and forth conversation even. It would be really exciting and interesting and engaging. But if you move off of that topic, it may become really difficult. That person might easily get bored. They're not as interested in having that conversation. And it may feel a little awkward on both sides.
I always remember one of my clients, somebody who, had been diagnosed with autism when she was very young, but one of her special interests at the time, and this is going to also kind of be dated, but was Justin Bieber, which...
Oh, yes. The Biebs.
The Biebs. And I would always ask her, how's the Biebs? What's going on? That was a good point of contact for us to develop that relationship and that rapport. But also, it was a great way for her to connect with her peers, too. Like she could use that as a strategy not strategy, but just like a way to connect. Strategy kind of diminishes it in some way. It was authentic. It wasn't a strategy. It was really what she was interested in and connecting with other friends with.
I love the beautiful interests of the clients that I have. Something that I often see too in girls is sometimes they'll be quiet. They'll be called shy by their teachers or introverted. I've had, women come to me that are looking for, whether they meet criteria, according to the DSM if they're autistic. And that's what they'll tell me. Well, I was always told I was shy. I was always told I was a good student. Oftentimes I'll see perfectionism, meltdowns at home, not necessarily at school, which leaves parents sort of scratching their heads as to what to do. Depression, social confusion, and not unlike boys, but what we'll see sometimes is this developmental gap widens around third grade or so, where it's not running around as much. There's more talking. Girls talk a lot. And sometimes if that's not something you're comfortable with or it's not an interest, that might be uncomfortable for an autistic girl. So, that's something we might also see as well. But definitely I see perfectionism, eating differences, anxiety. Those are often things that come up in girls who are autistic.
And I think it's impossible to have this conversation without talking about camouflaging and masking, which girls do quite a bit. And I think that sometimes also goes along with growing awareness that we have that autistic girls tend to be more socially driven. They're more interested in building those relationships. They're more interested in being in those, group social settings. So they may really struggle with it, but still want it, where sometimes I find that there are other kids who are autistic who really are satisfied just kind of being on their own. Like they don't necessarily need that or look for that in the same way.
So you touched on a bunch of, like you do, Emily, you touched on a bunch of beautiful things in a short amount of time. So I'm going to go back to the social part really quick and then kind of roll into masking. Socially, what I'll see sometimes it can be tricky is when there is an interest that's shared and that child feels engaged and they feel connected and they feel interested. But if that's not what's happening, sometimes they may want to be on their own. These things that aren't as interesting to them in a group, then the group doesn't become as exciting to be in. And I understand what you're saying about being socially driven. That can be really complicated for autistic girls. In masking, it happens so often, and really it's a survival issue. It's a coping strategy. And strategy, again, like you mentioned, in a way where it's necessary to survive in these environments that aren't built for them, where they're not understood. So them pretending to be someone they aren't or someone who they think will be accepted because they have to live in this environment and they feel like there's not another choice in order to get through the day or get through the moment.
That might be mimicking some of the behaviors that they see, or it might be trying to repress some of their own natural tendencies. Maybe that's, a sensory need or, some sort of movement or something like that, or a mannerism in how they communicate. And so trying to hide those things actively, that's a lot of stress for somebody to have to deal with day in and day out.
It's incredible. I can't imagine. And I'm glad that you brought up those sensory differences. When girls come to me, they will tell me how they've had to endure these terrible situations. Maybe they had to go to the gym for an assembly when it was just excruciating, or they had to attend PE when their bodies felt uncomfortable or sweaty or changing. This is moment to moment of complete discomfort, but not having an outlet or even a safe person to share this discomfort with. Sometimes I see that autistic girls have reached out and said, this is hard for me, and then it was dismissed.
Yeah, I think it's really hard to get people who haven't experienced sensory discomfort in that way to really understand what that is like for somebody who has those sensory integration differences. I'm always amazed at the number of parents and teachers who seem to think that you're going to be able to systematically desensitize somebody to those sensory experiences. Just by exposure, it's going to go away. It doesn't work that way. We have to find some other ways to work through that.
If you don't have sensory differences, you don't know. We can't begin to know.
Yeah.
The important part of all this is for us to be open to understanding. Again, I work with all, boys, girls, trans folks, everybody. But what I do see over and over again with girls is young girls, teenagers, adult women will see people don't understand when they act like they do. And we have to just be open to admitting that we don't understand, that we want them to share information. We don't want to discount or minimize their experience.
Yeah, we've all had the experience of something being too loud, but it's not the same as somebody who goes through their daily life experiencing it frequently and intensely and being unable to escape from those things. And I think sometimes because we think maybe that we've experienced it in the same way, or because maybe the language that we use to describe it might be similar, it's easy to diminish it and not really trust what somebody is sharing with you about their lived experience with that.
And I love that we're saying that, because most adult women that I work with will tell me they often feel dismissed. That people, of course, we only have our own experiences, and sometimes to relate to another person, we will think they're similar somehow. But we really need to be careful about doing that, because we all have our bodies and our brains that are different, our experiences, we're experiencing the environment in different ways, and really being open to understand that, because again, they often tell me people don't believe them because they, quote unquote, look okay.
Mm-hmm.
Or seem to be fine. Well, they're looking okay because they're often masking, and they're not okay.
Yeah, they're trying to just get through it.
More in a minute.
On Your Mark is a program that's making attending Marquette University easier for neurodivergent students. On Your Mark is a college success program designed to help neurodivergent students navigate Marquette. They work to build an individual support team and structure that neurodivergent students need to thrive in college. Everyone on that team receives training on best practices for working with neurodivergent students, and then the team assigned to the student helps them build academic, social, and independent living skills by offering one-on-one coaching, peer mentors, weekly seminars, tutoring, and mental health services. The focus is on communication and interviewing skills, relationship development, time management, self-care, stress reduction, and more. So, as you help plan your students' education future, remember the On Your Mark program for students enrolled at Marquette University in Milwaukee, Wisconsin. Learn more at marquette.edu/on-your-MARQ, or just look for a link in the show notes. This conversation about the sensory piece, sometimes autistic boys have very specific sensory discomfort related to the clothing that they wear. But if you think about it, the clothing that girls wear a lot of times that's gender appropriate may be more comfortable. Like it's more appropriate to wear leggings or to wear a dress or something that might be a little bit looser fitting, or to wear sandals in different situations. Whereas I think the social expectation sometimes for boys is khakis or jeans or, something like that. Although I do think now sweatpants and athletic wear has become much more common, which is great, I think, for those kids who have those sensory needs. But I do think that there's subtle things like that that also impede our ability to recognize how much those things are impacting somebody.
I think so too. That just gave me an example of a long time ago, I worked with someone who knew in advance that it would be difficult with clothes. So this autistic teen would wear certain clothes at the beginning of the day, maybe certain earrings that she could tolerate for an hour, but then she could take them off. Or layering clothes, doing these things that she's learned to adapt to the environment, but knowing that she was going to have to completely change what she was wearing in some ways because it was going to be uncomfortable at some point. And so, again, understanding that these sensory differences can be debilitating, whether this girl feels comfortable expressing it or not. Mm-hmm. Girls have learned to act like they're fine when they are falling apart on the inside. Mm-hmm. And then, like I said, that could end up having meltdowns later, and then that can be traumatic for them as well.
What other barriers are there that prevent girls from being identified? So there's kind of the differences in how we recognize some of those sensory things, but what else might be a factor there?
I think sometimes because we're not well educated in general about what girls look like, our brains automatically go to something else. So if a girl is struggling, she may be struggling in a way where, she's an introvert. We come up with these ideas of how girls might be presenting for some reason. Again, it's these default things that come up for us. She's quiet. She's well behaved. She's a rule follower. She just hasn't found her people yet, right? Instead of just saying, well, why is that? What can we do to support her and help her to be understood or help us understand her? What usually happens if someone has seen a therapist in the past before they come to see me, like more of a specialist, I'll often see girls diagnosed with anxiety or depression or possibly ADHD before somebody would consider that she might be autistic.
This reminds me of a recent situation that I ran into at my office, a client who I've been seeing for years, who is definitely autistic, was diagnosed as autistic when she was very young. I mean, I have clients sometimes where it's like, well, I know we have this diagnosis, or maybe we don't have an official diagnosis, and I could kind of question it, but not this situation. And they had a new psychiatrist that they visited with. And within 30 minutes, this psychiatrist had pronounced that she's not autistic. It's reactive attachment disorder.
Oh, my goodness.
I was so mad when this parent was talking to me about this. And I actually asked permission and said, because, sharing without any details or anything, they gave me permission to share about that actually, because it is such a problem. And people in the medical profession, I hate to say it, are some of the worst culprits.
Oh, I agree.
Pediatricians who they brush it off. They're like, oh, no, everyone develops at their own pace. And again, here's kind of the situation, like this particular client, very chatty. And so rule that out. Oh, they make eye contact. Nope, can't be autistic. It's like, it blows my mind, and it is so frustrating.
It's mind-blowing, and it's not at all surprising that I'm someone's second opinion.
Mm-hmm.
Oftentimes what happens is we can't be experts in everything. We just can't.
Right.
And when you go to someone who isn't trained to understand autistic girls or women, they are likely not to be identified. And usually it's from a parent pushing or the autistic woman pushing, saying, no, I know myself. I have an unfortunate story. I started seeing an autistic woman a while back, and she was telling me how when she had moved, out of the state and had gone to a different provider, they were actually arguing with her about being autistic or not. Oh my goodness, I've done the evaluation. I know she is. She knows she is. Why are we even having this conversation?
What's that thing, the Dunning-Kruger effect? It's like you don't know what you don't know. And I try to be aware of that. We all have our blind spots, but I'm much more comfortable telling somebody, that's not my area of expertise. I don't know that I can tease that out, or it would require this type of evaluation, or those types of things. But I just wish people would be more aware of the impact that has on somebody.
And, I think too, what can be a little bit tricky is when girls are diagnosed, sometimes parents don't know what to do with that information. And they tell me they're very fearful to share that with the school, or they're scared to share that with their child. And, every circumstance is different. But I typically urge parents to share that information in a way that's going to work best for that individual, because they're not going to be able to understand themselves in the way they could have. Yes, I'm autistic. That makes sense. Mm-hmm. And so I think sometimes there are diagnoses that people don't know about. I've had some women come and tell me that they were diagnosed when they were younger and they were never told.
Mm-hmm.
And that had a really big impact for them.
Yeah, it's interesting that you share that, because just before you shared that, I was already thinking about the parents who come to me and are concerned and say, how do I tell my child, or should I tell my child?
Right.
What advice do you give those parents about how to have those conversations?
I think it's important to be thoughtful about how each child processes information. I think it's good to ask the person who's doing the diagnostic evaluation what they also recommend. Parents know their children well. Sometimes it's good to tell them in a way that is related to their interest.
Mm-hmm.
Or do you know how you really like that and you get so excited? That is what's super cool about autistic people too. I've told so many children about their diagnoses over the years, and it's never been the same twice. I know it's a little hard to answer that question, but I really do think it has to be individualized. It has to work well for that child. There may be some different feelings that can come up, but typically what I see overall is, oh, that makes sense.
There's kind of like an underlying relief sometimes of things kind of clicking into place, even though there might be some uncomfortable emotions about it as well. I think allowing people, though, to live authentically and know themselves is just so important. And the more direct and straightforward we can be about things, the better we are at reducing the stigma.
I think so too. And depending on the family, and of course, everyone is different. Sometimes I'll hear, parents will want to tell their children, but they don't want their children to tell anyone else.
Mm-hmm.
And it really doesn't have to be a secret. This person's lovely way they're built and their lovely brain. And, this is not something that we need to hide. They're perfect, the way they are. But I do think mostly that just comes from parent fear. And again, that's understandable. They want to protect their child. But I think we just need to look at it in a different way.
I was talking to an autistic client the other day, and they were sharing about, we were just talking about the process of getting diagnosed, and they were diagnosed a little bit later. We were kind of joking a little bit. We're like, how did they miss that? Like, what was going on that they didn't see this? And they go, I think they just thought I was like my dad.
Oh, my goodness.
We just laughed and we're like, because there is so much of that too, where parents, if they are neurodivergent, it's quite possible that they never had any support and were never diagnosed. And so that also can be something that can hinder that process if you just are like, oh, well, this is just kind of like, it's a family trait.
Right. And, the better we get at supporting people and identifying people, there are so many connections within families. And oftentimes people our age, the parents, were not diagnosed. They were not identified. They were referred to as quirky or whatever terms you want to use. But you're absolutely right. But there is something really lovely about children, teens, adults learning about themselves, learning more about themselves, being able to identify with the autistic community, being able to appreciate their differences instead of thinking that they are not doing this right or that right. And that just weighs heavy.
Yeah, an appropriate label is better than any of the other labels that somebody is absorbing or hearing from the, environment or from society about how there's something wrong. It's not something that's wrong. It's just who I am. And I have strengths and struggles just like everybody else. And I think that message is really empowering.
I think also supporting girls in language. What do you say in a situation when this comes up? Like, for instance, if you're self-stimming and, someone asks a peer, well, what are you doing? Why are you doing that? Being able to help them with words, not to stop, because we're not doing that, but to say, my body needs to move this way.
Mm-hmm. It helps me think, it helps me focus, or it helps me relax, or whatever it is.
Yeah. And, I think being able to be identified and getting the support you need help in those everyday situations.
Yeah, definitely. As we wrap up our conversation, I have one last question for you. So if you were working with an autistic girl who had just received her diagnosis, kind of like we were just talking about, I know you said that it would be individualized, but ultimately, what would you say to her? Like, what is it that you would want her to hear about herself and her future?
I'm about to get a little teary here. I have such a heart for girls and women. There's so many things that I would say, but I would first say, you are amazing the way you are. Sorry, I didn't know I was going to get this emotional when you were asking me, because I've seen these girls, hundreds of these girls, and it's painful what they've gone through. And just really telling them you're amazing and you're lovely and you are not broken. You are beautiful, the way you are, and you don't need to pretend to be anybody but the beautiful person that you are. And it's going to be hard, but there's going to be joy and there's going to be pain, and, really surrounding yourself with people that care about you and love you and get you and will listen to you, and that you will find your people. And that might be through different activities that you're interested in. So you can share that activity with that person. You have that shared interest right off the bat to help reduce risk. That you are worthy always, that you being you is the most lovely thing that could happen. And gosh, I could go on forever, but I basically would say you are lovely the way you are.
Yeah, it's such an important message. Haley Blanc Moses, host of the Autism ADHD Podcast, thank you for your time.
You're welcome. Thanks for having me.
We need to be cautious about drawing too many generalizations about the intersection of gender and neurodivergence. There are a lot of factors that influence so many characteristics of neurodivergence. And if we assume that autism only looks one way in girls and another way in boys, we run the risk of missing an appropriate diagnosis. For many years, people talked about what ADHD looked like in girls versus boys. But once we improved our understanding of inattentive type versus hyperactive type, we were better able to drop the associations with gender and just see the ADHD. And, of course, variations in gender identity certainly complicate the entire issue. However, the bottom line is this. Appropriate diagnosis leads to a sense of self-understanding and self-acceptance. And when we understand the various influences that impact the ways certain signs of neurodivergence show up in different individuals, the better we're able to support them. I'm Emily Kircher-Morris. I'll see you next time on the Neurodiversity Podcast.
This episode is brought to you by On Your Mark, a college success program for neurodivergent students at Marquette University. You can call them at 414-288-0203 or look for a link in the show notes. Our thanks to Holly Blanc Moses. You can find information about her and her work on the episode page at neurodiversitypodcast.com. Hey, that's also the place you can find our A Little Weird is Good podcast t-shirt. Just click on merchandise at the top of the page. Our host is Emily Kircher-Morris. Our office manager and social media guru is Krista Brown. I'm the show's executive producer, Dave Morris. And for all of us here, thanks for listening, and we'll see you next time. This is a service of the Neurodiversity Alliance.